Assalamualaikum. We are from Group 6 and we would like to present a case which involves Stingray Envenoming. This is our group members. And this is the case of the Stingray Envenoming. In this presentation, we will start with the stingray injuries and envenoming background, signs and symptoms of stingray envenoming, first aid and in-hospital management for the stingray envenoming, and the monitoring parameters for the envenoming. Now we will start with the first part.
Next, we'll be on to the stingray injuries and the envenomations. So, for the natures of the stingray injuries, the stingray injuries has two aspects. First of all, the immediate physical trauma from the powerful penetrating action of the spine, and second, the envenomation at the site of the wound with the content of the raised integumentary siege. Although the venom is not always deposited during the sting incident, these two mechanisms may often work synchronously and may lead to the dangerous effect. So for the mechanical injury from the stingray spine, the stingray spine consists of the stellate-like, backward-pointing, serrated barb made of a hard bone-like cartilaginous material. The spine has two vertebral groove lines with the venom-secreting granular cell, and the entire structure is contained within the integument that rip opens when the target is struck. This can result in deep laceration or puncture if the introduction of the venomous foreign material. In about 5% of the injury, the spine may be broken off and remain in the wound, especially when the fish is full of from the victim. The penetrating of any part of the trunk, such as neck, chest, and abdominal trauma, may also occur with the potential for life-threatening damage, as the hemorrhage can occur, as well as the potential airway compromise and damage to the internal organ. Next, for the envenomations, all stingray venom are very similar to all species. They contain serotonin, 5-nucleotides, and phosphodiesterase. The latter of two enzymes, which is 5-nucleotides and phosphodiesterase, are responsible for the necrosis and tissue breakdown, with the seen in the stingray envenomation. On the other side, the serotonin is the cause of the local pains in the region of the injury. Since the serotonin in the stingray venom produces a severe and immediate onset of the local pain, any stings that are relatively free of pains indicates that there is no actual envenomation occurs. For the people who receive a dose of venom along with the physical trauma of being hit, tissue necrosis and subsequent of the secondary bacterial infections could occur, which result in extremely difficult to treat and may need several courses of the intravenous antibiotic and several courses of intravenous antibiotic may be necessary. That's all from me. Pass the floor to the next presenter.
Alright, I will continue with the sign and symptoms. The main symptoms of stingray sting is immediate severe pain. Although it is often limited to the injured area, the pain may spread rapidly. Second, the wound usually is checked. It may bleed freely, and the edges of the wound is often discolored. It may be redness or blue coloring around the wound, and sometimes swelling may also be present. Syncope is also very common, and this may be due to peripheral vasodilation. And among the other uncommon effects of the venom is it can also cause nausea and vomiting, hypotension, arrhythmia of the heart, and even seizure. Muscle cramps and abdominal pain can also occur, and lastly, also respiratory distress. And if this happens, it will require immediate emergency medical care.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Izzah Hayani binti Mahmud Kamal, metric number 1917698. So I will continue the presentation with the management of stingray envenomation. which will cover the pre-hospital or first aid management, and then followed by in-hospital management. So for the first aid management will be explained by me, while the in-hospital management will be further explained by Sister Aimasita. Okay, so when a person is stung by a stingray, the pain from the stingray sting is usually twofold. One from the tissue injury and then from the effects of the venom. So it will be most likely for the patient to be panic and complain of excruciating pain. So for the first thing that we should do when we encounter this kind of patient is to relax and calm the patient, and then be sure to do the basic ABCs of first aid, which are first to ensure the patient's airway is cleared, and then to check for the patient's breathing by placing our cheek next to the patient's mouth and feel his breathing. And then lastly is to check for the patient's blood circulation through his pulse. Okay, so next, notice that the patient has two types of wounds. The first one is puncture wound on his left knee, resulting from the stingray barb. And then the second one is abrasion wound next to his left nipple, resulting from the dermal scales of the stingray. So for the puncture wound, we should control the bleeding by applying direct local pressure to the wound with elevation of the affected body part. And then we should cover the puncture wound by applying bandage around the wound while keeping the barb immobilized. This is because if the barb is pulled out, whether accidentally or not from the patient's skin, it will result in massive bleeding and probably fatalities to the patient. And then for the abrasion next to his left nipple, we can simply wash it with fresh water to help sanitize the wound from any bacteria, and then put dressing on the wound. So just an example of first aid bandage for the puncture wound that I said just now. This may be not the best picture that I can show, but the bandage should be somehow look like this, where most importantly is to keep the barb immobilized until we reach the emergency department for further treatment. So I think that's all from me. I'll pass to Sister Aimasita for in-hospital management. Thank you.
Next, I will explain about in-hospital management. The first one is to ask the characteristic of the fish, where and when did the incident occur, symptoms that has experienced by the patient, and management that have been done before reach to emergency department. Next is to assess the patient medical history, vital sign, body weight, pain score, and to determine the early warning score, and to assess the renal and liver profile, and to perform ABG test. It is important to check for any underlying disease and allergy, if any, to prevent any contraindication with the management letter, and to carefully examine the wound and removal of orange material, and run X-ray to check any bulb of orange body at the wound site that cannot be seen with the raw eyes, and to take a small sample for culture and sensitivity test. In chest pain management, we can use diazepam 5 mg per ml, slow IV 1 mg every 2 to 5 minutes up to a maximum dose 10 mg. If necessary, dose can be repeated in 2 to 4 hours. And prevention of pulmonary embolism and venous thrombosis that can potentially occur, we can give enoxaparin sodium 0.5 mg per kilogram every 12 hours subcutaneously. And for appropriate analgesic, mild and moderate pain, we can use paracetamol syrup 250 to 500 mg per dose. If patient is unconscious, he should receive paracetamol IV infusion 5 mg per kilogram with a maximum dose 60 mg per kilogram, not exceeding 3 grams. If patient body weight is more than 33 kg and less than 50 kg, this dose is depend on patient body weight. For severe pain, we can use IV tramadol 1 to 2 mg per kilogram for 2 to 3 minutes. And we can use prophylaxis antibiotic that is effective against fibrosis and skin flora. If patient is conscious, he can receive doxycycline tablet 200 mg, stat 10 100 mg orally every 12 hours, plus minus with IV ceftriaxone 2 to 80 mg per kilogram every 24 hours. If patient is unconscious, he should receive IV ceftriaxone 20 to 80 mg per kilogram every 24 hours. And lastly, we also should ask about tetanus vaccine or tetanus booster. If patient has done with tetanus vaccine third dose and complete with vaccine booster, he should not receive tetanus prophylaxis. If not, he should receive tetanus prophylaxis, which is the tetanus immunoglobulin TIG 250 IU by intramuscular route.
Now, I will continue with the monitoring parameters part. This patient needs to be monitored regularly to ensure better outcomes. The first monitoring parameter is the vital signs. This includes blood pressure, heart rate, respiratory rate, SpO2, temperature, pain score, and early warning score. These vital signs are important component of monitoring patients' progress during hospitalization, as they provide basic indicators of patients' health status and allow for the prompt detection of delayed recovery. Next, the laboratory data of this patient must also be monitored. Among the essential parameters are full blood count, arterial blood gas, baseline renal and liver profile, electrocardiogram, which is ECG, troponin, creatine kinase, and blood or wound cultures and sensitivity. The purpose of ECG is to monitor electrical activity of the heart and to detect cardiotoxicity or cardiothoracic injury that may be caused by the Stingray bug or toxin. The troponin is helpful to detect angina or heart attack, and the creatine kinase is used to detect muscle injury, cardiac injury, or cardiotoxicity. The blood culture is used to detect the presence of infection. Next, the condition of the wound must also be monitored. It is necessary to detect the presence of infection, or it is also compulsory to confirm local and systemic effects of Stingray injury and complications. The infection will exhibit inflammation signs such as erythema, pain, swelling, purulence, and loss of function. That's all from us. Thank you for listening.